I have a question for you. If you went to a car dealership and paid for a brand new Ferrari, but they drove out a 1995 sedan with a flat tire and a smoking engine, would you feel ripped off? That is exactly what is happening to every single one of us in the American healthcare system. We are paying luxury prices for a broken product. I just finished digging through 20 of the most astonishing statistics about our health industry, and honestly, it's worse than I thought. We aren't just spending a lot. We are being drained. Today, I'm going to show you the numbers that prove the industry is a money-making machine first, and a healing system second. Let's start with the money. Because, wow, we are really spending it. Did you know that US healthcare spending has jumped nearly 300% since 1980? Back then, we spent about $2,900 per person. Today, we are spending over $11,200 for every single man, woman, and child in this country. But wait, you might say, maybe that's just how much medicine costs now. No, it's not. The US spends about 18% of its entire GDP on healthcare. Germany? They spend 11%. The UK spends less than 10%. The average person in other developed nations spends about $5,700 a year on their health. We spend double that. The question is, what are we getting for that extra $5,000? Are we living twice as long? Do we have bionic limbs? The answer is no. In fact, despite being the most medicated, expensive population on Earth, we are actually one of the sickest. We have the lowest life expectancy among developed nations, stuck at around 77 years old. Compare that to our peers who are living into their 80s. It gets darker. We have the highest infant mortality rates and the highest maternal mortality rates in the developed world. We are paying Ferrari prices and the car won't even start. Why? Because the system isn't designed to keep you healthy. It's designed to bill you. I want to talk about the markup. It's insane. Let's take a hip replacement. If you need one in Australia, it costs a certain amount. If you get it done here in the US, you are paying 64% more for the exact same surgery. And drugs? Don't get me started. Humira, a common drug, costs 35% less in Germany than it does here. Because of these prices, 57 million Americans, maybe you're one of them, have had to cut back on food, clothes, and basic household spending just to pay medical bills. And here is the statistic that broke my heart. According to recent data, 48 million people in this country cannot afford their prescriptions. Think about that. We have the medicine. It's sitting on the shelves. But because of the price tag, millions of people just go without it. If you think you're safe because you have a job, think again. Unexpected medical bills are now the #1 cause of personal bankruptcy in the United States. They account for 60% of all bankruptcies. The average age of someone filing for medical bankruptcy isn't an elderly person at the end of their life. It's 44.9 years old. That is the prime of one's working life. And for those who don't go bankrupt, they just live in debt. Over 1 in 3 American adults is currently carrying medical debt. I saw a stat that said 40% of adults have skipped a recommended medical test or treatment because of the cost. 40%. That means we are letting manageable problems turn into life-threatening ones because we are terrified of the bill. So, if we are all broke, and the hospitals are charging 600% more than they did in 1990, where is all that money going? It's going here. While your wages have gone up about 155% since 1990, healthcare costs per person have gone up 366%. In 2021 alone, United Health Group reported $201 billion in revenue. CVS Health earned $184 billion in the same period. These aren't just businesses, they are empires built on the back of your sickness. 5 major healthcare providers recorded profits of over $100 billion each in 2020. Their executives are popping champagne while 70% of people with medical debt are cutting back on groceries. If we don't change this, it's going to get dystopian. Estimates show that by the year 2040, the average cost of a single hospital stay could reach $135,000. That is 3 times the cost of a new car. That is the price of a house in some parts of this country. Just for getting sick once. The system is intentionally broken. It is a massive wealth transfer from the working class to a handful of corporations. I want to know your story. Have you ever skipped a doctor's visit because you were afraid of the cost? Have you ever left a prescription at the counter because it was too expensive? Leave a comment below. We need to talk about this, because the only way this changes is if we stop accepting it as normal. It is not normal. Thanks for watching. Stay healthy, if you can afford it.